Hello, future clinicians. Welcome to Medical English Pro. Today's topic is headache history taking, a cornerstone in neurology OSCEs. Headaches may seem common, but their causes range from benign tension headaches to life-threatening conditions like subarachnoid hemorrhage. That's why history taking here is unique. We'll start with a professional role play, then extract key phrases, vocabulary, and exercises. By the end, you'll be able to handle headaches in English with confidence and professionalism. Section 1. Role Play.
Good morning. I'm Dr. Ben. What seems to be the problem today?
I've been having headaches for the past week, and they're getting worse.
All right. Can you describe the headache for me?
It's like a tight pressure around my head, mostly here.
Okay. When did it start exactly?
About 7 days ago, it wasn't too bad at first.
And since then, has it stayed the same or changed?
It's definitely worse, especially in the mornings.
So this is a progressive headache, worse in the mornings. Is the pain on one side or both sides?
Both sides.
And how severe is it on a scale of 0 to 10?
Maybe 7.
Do you have any nausea or vomiting?
I feel sick sometimes, but I haven't vomited.
Any sensitivity to light or sound?
Light bothers me a bit.
That helps me understand whether this could be something like migraine or a tension-type headache. Have you noticed any problems with your vision? Blurred vision, double vision, or loss of vision?
Sometimes my vision goes blurry for a few seconds.
Any weakness, numbness, or difficulty speaking?
No.
Any fever or neck stiffness?
No fever. My neck feels a bit stiff in the mornings.
So, intermittent visual disturbance, no focal neurological symptoms, no fever on a background of hypertension. Is that correct?
Yes.
Thank you. I'd like to examine you and check your blood pressure and neurological function.
Section 2. Killer phrases. Instead of random phrases, think in 4 diagnostic blocks. 1. Time and evolution. Most important. When did it start? Is this a new headache or a familiar one? Is it getting progressively worse? Examiners listen for new plus progressive. 2. Character and location. Is it unilateral or bilateral? Pressure-like, throbbing, or sharp? Severity on a scale of 0 to 10. This separates tension, migraine, and red flags. 3. Associated features. Red flags live here. Nausea or vomiting? Photophobia or phonophobia? Visual disturbance? Neck stiffness or fever? This is where you pass or fail. 4. Risk context. Any recent head injury, medication overuse, hypertension, family history of migraine. Always ask why now. Section 3. Practice. Exercise 1. MCQ mode. Choose the best medical English option. 1. The headache has been gradually getting worse. A. The headache is changing. B. The headache is progressive. C. The headache is increasing. D. The headache grows. Think clinically. Correct answer, B. Progressive. 2. The pain affects both sides of the head. A. Dual-sided. B. Whole-sided. C. Bilateral. D. Double. Correct answer, C. Bilateral. 3. Ask about migraine-associated symptoms. A. Light problem. B. Sensitivity to light. C. Photophobia. D. Eye pain. Correct answer, C. Photophobia. 4. Professional phrase for seeing blurry for a few seconds. A. Vision problem. B. Blurred eyes. C. Visual disturbance. D. Eye weakness. Correct answer, C. 5. Red flag symptom. A. Stress-related pain. B. Progressive morning headache. C. Family history. D. Bilateral pain. Correct answer, B. progressive morning headache. 6. Ask about painkiller overuse professionally. A. How many pills do you take? B. How often do you use analgesics? C. Do you like painkillers? D. Do pills help you? Correct answer, B. How often do you use analgesics per week? 7. Best case summary phrase. A. The patient has headache. B. The patient complains of pain. C. New onset progressive headache. D. Strong headache. Correct answer, C. New onset progressive headache. Exercise 2. Clinical Priority Challenge, OSCE style. You're taking a headache history. In each situation, choose the one question you must ask next. Scenario 1. Patient says, the headache is worse in the morning. What do you ask next? A. Does stress make it worse? B. Have you taken any painkillers? C. Does the headache wake you from sleep? D. Is the pain on one side or both? Think like an examiner. Correct answer, C. Morning headache equals raised intracranial pressure red flag. Scenario 2. Patient says, I sometimes see blurry for a few seconds. What is the most appropriate next question? A. Do you wear glasses? B. Do you have eye pain? C. Do you have double vision or loss of vision? D. Is the headache severe? Correct answer, C. Screening for neurological red flags. Scenario 3. Patient says, I take paracetamol almost every day. Your best follow-up. A. Why do you take it? B. How many tablets do you take per day? C. How often are you using analgesics per week? D. Does it help? Correct answer, C. Medication overuse headache assessment. Scenario 4. Patient says, I've never had headaches like this before. What should come next? A. Any family history of migraine? B. Any recent head injury or trauma? C. Is the pain throbbing? D. Does noise bother you? Correct answer, B. New onset headache equals secondary causes first. Exercise 3. One sentence clinical summary. Advanced. You are finishing a headache history. Summarize the case in one clear professional medical English as in an OSCE or ward presentation. Do not list symptoms. Think age, timeline, key features, red flags, background. Case recap. 24-year-old woman, recurrent headaches for 6 months, unilateral, throbbing, associated with nausea and photophobia, preceded by visual zigzag lines lasting 20 minutes. No neurological deficits, no systemic symptoms, family history of migraine. Task: write one sentence summarizing this case in professional medical English. Use this structure if needed. This kind of summary is what examiners love: clear, structured, and diagnostically focused. Write your sentence in the comments. I'll review all of them. And that's it. Headache history is not about pain. It's about onset, progression, red flags, and risk context. Miss one, lose marks. If this helped, like the video and subscribe. Follow for more Medical English Pro.